I'm Debbie Larson, and I will be introducing the second panels of speakers covering new evidence. And our first speaker is Helena Archer. Helena Archer is an epidemiology PhD student at the University of California, Berkeley, who is studying the intersection of infectious disease and the natural and structural environment. Her research interests include system science, health system disruptions and disasters, and health disparities. Prior to starting her program, she worked in maternal and child and injury epidemiology at the local and federal level in Arizona, and health informatics at a nonprofit in Lusaka, Zambia, and in global health research consulting while completing her master's in public health at the University of Washington. At Berkeley, she works on evaluating environmental and individual risk factors for COVID-19, including the environment of California state prisons and exposure to oil and gas well production. Helena?
Yes, I'm going to talk to you today about a study we've been working on with colleagues at Berkeley and UCSF, looking at COVID-19 outcomes in oil and gas production. And I just want to say, well, thank you to David, who you heard from earlier. And just similarly, I'm representing myself here today as our union at UC Berkeley is currently on strike. So yes, without further ado, I'm sorry, I should move the screen, adjust it. Okay, great. So this project was developed as a companion analysis as a study done by the University of California, San Francisco in Tracking, California, who are looking at air quality for COVID-19 outcomes in PM 2.5 across California. The study was recently published, if you're welcome to check that out. And I mentioned that because it really gave us a great opportunity to work with them, both to learn from their expertise and to take advantage of some excellent COVID-19 data that they've been able to collect, and specifically access to COVID-19 case records and death data across the entire state of California. Our objective in this study was to look at how area level exposure, to oil and gas production related pollution and measured through residential proximity to producing wells may have affected COVID-19 outcomes in the first year of the pandemic. I was very excited when joining this project that it was already very connected to policy and advocacy groups via the Center for Race, Poverty, and the Environment and the California Environmental Justice Alliance, which many of the people I work with are actively involved in. And that's particularly important as there's a really active policy environment in California right now. And I was, as sort of a background, I'm a little bit newer to oil and gas wells. So I imagine that you all probably even know much more about this than I do, but it's been really great to be a part of the sort of research to action pathway where there's really some potential direct impacts of what we're finding to produce additional evidence around oil and gas wells and health outcomes in this context. So I don't think I need to overstate the impact, but between December 2020 and May 2022, there were at least 82 million recorded cases and 1 million recorded deaths from COVID-19 in the US. For prevention of future pandemics and really understanding what's happened over the past several years, it's very critical that we understand environmental drivers of disease as we develop policy and, continue to understand the effects of what's happened. Early on, there was a significant interest in air pollution and COVID-19 across researchers. This pretty recent systematic review, which I think came out in August or September, had looked at quite a number of studies, 52% of which reported a positive relationship between air pollution and COVID-19 incidence, and about another half as well reported a positive relationship between air pollution and COVID-19 mortality. As you can see, PDFs. Okay. As you can see on this figure on the right, the blue is positive relationships, and these are some of the drivers that they acknowledge, including PM 2.5 and NO2. Quite a few reported positive relationships, but quite a number of others reported a sum of none and mixed, which just from our epidemiology perspective, since we were talking a bit more about evidence, can mean a lot of things because that can be sort of, and that's they're talking about the direction of association, but that also has to do with sort of what we think of as statistical significance. And it's still interesting to sort of think about what those findings mean as we broaden our tools and work on our methods. So similarly, I think the impact of oil and gas wells is well understood in this audience, but globally, over 600 million people are estimated to live near oil and gas development, including an estimated 17.6 million in the United States in 2017. And we know that it emits multiple pollutants, including NO2 and PM2.5. And of course, has been well highlighted by the speakers on the first panel. There's a lot of research that's looked at residential proximity to active drilling with adverse respiratory and cardiovascular outcomes, many of which may be on the pathway for our purposes between COVID-19 and oil for COVID-19 acquisition and for more severe COVID-19 outcomes. I just want to acknowledge that this is also linked to environmental justice research, which again is as well highlighted in the first set of presentations, that there's new evidence around certain communities and particularly communities of color, at least in California and across, and it's really with some regional differences and disproportionate exposure to oil and gas wells. And there's some photos to highlight that. So in this study, I won't spend too much time on this, but I want to just give a brief review of sort of how we looked at it. So we took this from an ecological cohort study design, meaning that we looked at this as an area level exposure. We wanted to sort of try and make this as precise as possible. So we looked at census block groups, which are geographic units, and I'll show them a little bit later, generally containing about 600 to 3,000 residents. There's about 23,000 of these in California. And we aggregated our cases and our deaths to these groups, and then we wanted to look at area level exposure over these relatively small geographic areas as well. And as I mentioned, we looked at COVID-19 incidence and mortality in the first year of the pandemic between February 2020 and January 2021. Some of our key considerations were how we wanted to assign oil and gas production to our areas from this ecological perspective, as well as for COVID-19, the really changing policy knowledge and pattern environment over the study period. Don't spend too much time on this, but some of the covariates that we considered were individual age and sex, which are available as sort of described in the case records, area rurality, census-derived characteristics for racial and ethnic demographics, and a composite socioeconomic indicator, the area deprivation index. We did also conduct a sensitivity analysis of comorbidities. And for our statistical analysis, we elected to use multi-level hierarchical Poisson models, and we used random intercepts to sort of account for additional spatial variability between the census block groups and the census tract, which are really the next level of geographic units, which is an important dynamic when looking at both environmental exposures and then when looking at infectious disease, sort of thinking about how your community risk really influences your individual risk of disease as well, with patterns of spread and patterns of transmission. So for our exposure assessment, we ended up electing to use asymmetric methods. So there's about 2.1 million residents in California that are estimated to live within 1 kilometer of an active oil and gas well from 2019. This figure on the right is from a paper by Joan Casey and colleagues, who I'm honored to be sharing their virtual stage with. But I think they did a really great job of illustrating this method in this paper. And so essentially what we wanted to do was, within these block groups, there's a variety both in terms of the number of people and in terms of really the geographic size and rurality of each block group. So using asymmetric methods, what you do is sort of take advantage of other data, and specifically in this case, tax parcels and building footprints, to isolate where populated areas within the block groups are, so that when you're assigning your oil and gas well exposure, you create a buffer around your well, and you're just looking for that overlap between where the populated areas are within the block group and where you believe this sort of potential exposure is happening. So as you can see in this figure, a block group that has populated areas that are not close to the well won't be included, even though we're technically overlapping with the block group boundary, whereas ones that do would be considered exposed in our analysis. So for our purposes, we used 1 kilometer as our barrier for exposure, and then we considered for creating sort of these groups or strong comparison groups, we decided to use people that were 3 to 10 kilometers away. So the hypothesis is that you live within 10 kilometers of a well, so you're probably more likely to be like people who live close to wells than people who live further away from wells. There's a trash pickup in the background. Hope it's not too loud. Let me know if so. And to use those as a comparison group. So what this looks like on our level is, this is census block groups around very much in the Los Angeles area. So you can see in red, those are the block groups that we considered exposed, which again intersect with our populated areas within 1 kilometer of our well. And our unexposed groups are in blue. So those are the people that were 3 to 10 kilometers away from a well. We elected to drop this intermediately exposed group, so these people within 3 to 10 kilometers, as we thought there could be, to really sort of make a control group that we had good, we really believe, and this approach has been used by others as well, that would not be exposed for our, for the purposes here, or to really clearly delineate between our exposed and our unexposed people. And to assign production, we used average annual production rates from 2018 to 2020. So what we believe in thinking about those causal methods likely precedes COVID-19 rates. So what this sort of looks like in total, of the 23,000 block groups in California, we isolated 6,000 for our total population. About 20% of those are exposed and 80% unexposed. So across these block groups, as you can see in the bottom right, we decided to further group these into tertiles among our people who we considered exposed based on the amount of production exposure assigned to them. And as you can see, there's a real variety there, with sort of an average of around 1,000 barrels of oil equivalent in our lowest group, and 155,000 in our highest group. So there's quite a range there in terms of what we're seeing. Oops, sorry. The other thing I wanted to just mention is that we talked a lot about, I mentioned sort of this changing policy environment and changing COVID-19 environment. And unfortunately, that's not something that there's great data available on, is sort of how policy and testing changed at this lower level of granularity. So since we weren't able to capture that, we decided to look at the time trends going on in the background. And these are cases on the left, stratified by age and sex as available from the data, and deaths on the right. And you can see there's sort of these three major time periods. There's three general trends. And so we ended up also deciding to stratify our analysis on the first 4 months of the pandemic. Information was new. The second 4 months, if you stretch your mind back, that summer outbreak, and then the third 4 months, which is really that first winter surge that we saw. So for our results, if you bring your attention sort of to what's highlighted on the right, I wanted to include the full table. What we saw in the first 3 months of the pandemic, and this is looking at cases, we found about an association of about 1.09, so 1.1, so fairly moderate association between oil and gas wells and COVID-19 in our two lower tertiles, and a higher one, about 1.3 in our highest exposure tertile. So people that we believe are most exposed to oil and gas wells. And there's some varying significance, but I think it's important to present all the results. That tends to moderate a bit in the second time period and then tip off a bit in the third time period. And that relationship is pretty flat across the time period as a whole, but again, higher in this first tertile. For deaths, we see somewhat of a different, but nonetheless similar pattern in our highest exposure tertile, where in the lower group, we saw about 1.2, really kind of an inverse relationship in this middle tertile, and then again, a higher rate, and for our purposes, what we consider statistically significant. So the evidence suggests that this is something that we may want to pay more attention to in our highest tertile group, of about 1.5 times the rate of death in groups that were highly exposed to oil and gas production to people compared to people who were not exposed, who we considered unexposed to oil and gas production over this time period. And again, that varies a little bit in these second two time periods, where it flattens out and looks a bit different across the whole, although we still see a relationship in this highest tertile for deaths when we look at the period across the whole. So what to sort of think about these results? So some of the limitations of our study are that this ecological design, it does, we're looking sort of at area on area, and ideally in the future, we can assess individual risk. Again, this limitation on sort of data and policy testing across the study period, and the fact that it's a fairly complex relationship to assess, both because of the data and then because of the fact that we're really trying to, generate more evidence around understanding what this looks like and sort of what we consider exposure to be, and that can really vary in terms of how people do that. But we feel that we, found some interesting information, and some of our thoughts were that the results for the time stratification, especially in this thing where we're looking at the first 3 months of the pandemic and seeing higher rates in that time period, might be telling us, if we sort of do further study to continue to evaluate our results, that these communities may be at higher risk sort of in the first time period for future respiratory outbreaks. And that can be particularly important, as that's the time we have limited sort of scientific evidence and evidence of treatment. Persistence of these relationships, despite assessing confounding and some high variability across areas, especially for mortality, which we think bears further investigation. I'll wrap up since I think I'm about out of time. But we hope that this contributes to evidence around the oil and gas literature for health and infectious disease. We look forward to sort of refining our results and submitting for publication, and particularly disseminating them to policy and advocacy partners. So I'm glad to have the opportunity to do that today. And thank you so much to everyone involved in this study and the support, and I will stop there.